If you've been told that your symptoms are just a part of aging, or that you're too young to have perimenopause or menopause symptoms, or that maybe you shouldn't have hormones, you should try these other things first, or that maybe you're even just worried about going to the provider because you're worried about being dismissed. Well, this video is for you. We're going to help you with a few different ways that you can hopefully increase your chances of success with your provider in prescribing potential medications to help you and your symptoms. My name is Eric Schmidt. I'm a board certified OBGYN, minimally invasive gynecologic surgeon. In this video, we're going to be talking about my recommendations for finding the right menopause doctor for you. Because unfortunately, it's a little harder than one often thinks. In one study, there was about 73% of women who were talking with their healthcare provider bringing up menopause symptoms and felt like they went unaddressed. We're looking to reverse that. There are a number of reasons why so many providers are uncomfortable with treating menopause symptoms, from the poor studies and interpretation of studies done in the early 2000s, the lack of training in this specific area, the lack of responsibility by providers. So I'm going to hopefully give you a few tips and recommendations for hopefully increasing the chances of having a good experience with your provider when talking about menopause symptoms. Point number one is find somebody that is menopause literate. And while a lot of different specialties may take care of women with menopause complaints, whether it's from your OBGYN, your family medicine doctor, internal medicine doctor, endocrine doctor, so many could take care of menopause symptoms. However, very few actually take the responsibility, as so many midlife women are affected by it. But the best way you can probably increase your chances are doing the research by going to the North American Menopause Society and looking up to find one near you. Now, unfortunately, in a lot of areas, there might not be one listed. There is another website you can check out, the ISHWISH website, or International Society for the Study of Women's Sexual Health, is also an area where you can find somebody well-versed in menopause and sexual health. I think it's certainly helpful as a provider to have yourself on one of these websites to convey to your patient that you're interested in this topic, because that's what it really takes to be a menopause provider, is interest in the topic. I think unfortunately it's easy for people to dismiss these symptoms as a provider if you just aren't as interested or you don't specialize in that area. And so being on the North American Menopause Society website or the ISHWISH website, you're going to show to your patients that you're interested in this area and you're interested in hearing out all of their concerns regarding this. Or in somebody's bio, if they have a special interest in menopause midlife care, they're probably going to say it on their bio. All right, perfect. You found your menopause provider. You're waiting for the appointment to see them. And my tip number two for increasing the chances of having a good experience is to document. And so document your symptoms. Don't wait for the doctor to just ask you all the questions. Now you're going to want to know, like, okay, my hot flashes, how many times am I having them? Is it every day? Is it multiple times per day? Is it affecting your ability to concentrate, your ability to have interpersonal relationships, your ability to work or be around your family? All this is going to help convey the urgency and severity of your symptoms so the doctor knows the best treatment, hopefully, for you. Also, you're going to list the different types of symptoms you're having: hot flashes, night sweats, brain fog. And so if you're going through that perimenopause time and you're, let's say, 44 years old and you're starting to see some of these differences, try and take the days or weeks before your appointment with your provider to think of all of these things that you're experiencing, so they can help you not only with the medications, the supplementations, to make the game plan that best fits you. All right, tip number three is making sure you know your own personal and family history. Having, if there is a strong family history of cancers, or for sure your medication lists, what medical problems you do have. So you can be confident when you're explaining these things to your doctor. However, now there's actually very few, big red flags or stops when it comes to prescribing hormone replacement if it's done in a responsible way. And so people can have hormone replacement even if they have a history of diabetes, even if they have chronic hypertension or high blood pressure, chronic diseases like this, and it can be given safely, often with things like an estrogen patch. Sometimes the oral route to the medication may increase somebody's clotting risk and those factors, which we used to be so afraid of in the decades previous with hormone replacement therapy. And so just knowing your own personal and family history is going to be super important regardless. And let's move on to my last tip and tip number 4. All right, tip number 4 is, well, how to best navigate the conversation. If you are an overall pretty healthy person without a history of things like breast cancer, the overall risk for you taking transdermal estrogen is extremely low. And so you may be presented with an option. Option 1, hormone replacement. And that is often what we've talked about in this channel. But that's going to give you the best, most immediate relief. However, each individual might want to start differently with supplements or other medications. There are non-hormonal medications to help treat some of these symptoms, like the hot flashes, and maybe even the brain fog and the night sweats. There are some medications and supplements for those, but overall, the best improvement that someone's going to have is with the hormone replacement. And so I used to have a higher threshold for starting hormone replacement. Now, instead, it's actually super low. If somebody is, in fact, doesn't have the very select situations where we don't use hormone replacement, often starting the hormone replacement is the best thing to do, and not have somebody start like an SSRI to help manage those symptoms. Start other medications that actually have quite a bit of side effects. If the provider is potentially wanting you to try non-hormonal options first, I don't always agree with this unless someone has a very specific concern that why they can't do hormone replacement. And basically that is like breast cancer or hormone sensitive cancer, is one of the only situations where we wouldn't, or we'd have extreme caution trying hormone replacement. Also, there is this old myth of trying to get people off their hormone replacement. The thought with these initial studies decades ago was that, someone should only be on it for 5 or 10 years, when in fact, I think there's a lot of good and emerging data and just feeling as we're prescribing these medications now more regularly, that someone can potentially be on it for the rest of their life. And so if somebody's restricting your hormone replacement, saying you can only be on it for 5 or 10 years, that is kind of a yellow flag. Or if someone is trying to, always try the non-hormonal options first and make you go 3, 6, however many months or years with trying these before they give you hormone replacement, I think that is yellow to red flag too. I hope these tips help for making sure that you know how to give yourself the best chance of having a good experience when it comes to this. And so we can start changing some of these statistics around about people being ignored and gaslit regarding their menopause symptoms. Everyone have a great day. Quick reminder, this is part of our fundraising video where we're trying to raise money for gynecologic cancer research. There is a link below for that research link. If you are able to give, or you found this information valuable and you would like to give, please do. It doesn't have to be large amounts. Every little bit helps. All right, everyone, have a great day. We'll talk to you soon.